why you get volume loss, what it is, and how we can make it look so much better, even maybe better than when you did before you had the volume loss. Some of them actually move with time, so they go from being up higher in your face to lower in your face. If you lose weight rapidly, volume is going to get redistributed in your face. It's going to fall and shrink, and your face is just where you're going to notice it a lot more. Think about filler in the cheek area, in the temples, in the under eye. These are all popular places to restore some volume. What is volume loss and how do you fix it in this day and age? We've come a huge, long way from just being able to use fillers, and now we're actually entering into a new phase of how we restore volume. So let's get into the reasons why you get volume loss, what it is, and how we can make it look so much better, even maybe better than when you did before you had the volume loss. Remember, if you like this type of content, I'm a facial plastic surgeon, so like, subscribe, follow for more, and let's get into it. So, volume loss. It's kind of a catch-all term for losing fat in your face. Now, does it actually happen to everyone? Sure, probably with time. But what actually happens in the face is that you have multiple fat compartments. Some of them actually move with time, so they go from being up higher in your face to lower in your face. So it'll look like you're losing volume in the mid part of your face. And then they also start to shrink. So the fat pads in the superficial layer start to shrink up with time. And the next is that fat pads actually separate from each other. So if you imagine a baby, very plump, really big cheeks, they're really, really high up. There isn't any area of demarcation between them. But as we move through time and fat starts to slip away and get smaller, a lot of people develop lines that end up right here, and you end up with concentrated volume down in the lower face. So volume loss has become a huge, very popular term from filler companies because the idea is that you're constantly trying to make up that volume loss by adding something to it. And that's how we ended up with the sort of 2010 to 2020 timeframe where people were looking overfilled because volume loss was being diagnosed way too much. And so here's the thing about volume loss. Why does it happen? Well, a lot of things can happen. If you lose weight rapidly, volume is going to get redistributed in your face. It's going to fall and shrink, and the face is just where you're going to notice it a lot more. The other thing is with time, as you age, you're going to lose volume in your face, you're going to lose collagen and elastin, and the volume loss is going to be more noticeable. And then lastly, it's just a genetic thing. You'll notice that some kids will have some volume loss in the mid part of their face because of severe allergies or inflammation. These are all things that contribute to volume loss. And volume loss, remember, is just a catch-all term to changes in fat distribution in your face. How do we repair these types of things? Well, the first thing to remember is that you have to be given the right diagnosis, right? So just like any medical treatment and just like any medical procedure, you need the proper diagnosis to figure out which treatment you get. The nice thing about volume loss is that there are lots of ways to combat it depending on what you're interested in and what your long-term goals are. The first and most common one is obviously filler. So filler is hyaluronic acid or calcium hydroxyapatite. We inject that into the face. It can be injected on bone. It can be injected under the skin in the subcutaneous areas, and sometimes even superficially. Think about filler in the cheek area, in the temples, in the under eye. These are all popular places to restore some volume. Now, you have to remember there's a downside to adding filler. One downside is that filler can migrate. It can also tend to absorb a lot of water. So if you're getting a lot of filler under the eyes, you might notice these like sort of big blue sausage rolls under the eyes. It's pretty common. And the other thing is that filler will eventually fade with time. It'll redistribute in the face. And over time, lots and lots of filler doesn't really look all that great or natural. So that is one reason why people have moved away. I don't think that it's a bad thing to do. I actually think filler is great. It just depends on what you're trying to accomplish. But we've moved really far away from filler into something called biostimulators. Biostimulators can actually help you build your own collagen through time. These are things like Sculptra or a filler/biostimulator mix, which is Radiesse. These help restore some of the collagen that you've lost, but the downside is that they actually take some time to build, and there's some question about scar tissue. So as you know, I do facelifts, and when I've seen patients have, biostimulators used in the face, we notice some scar tissue there. Is it a big deal? Generally not really. Is it better to have that than it is to just go ahead with the facelift? It really depends on your goal. But the other thing to remember is that surgery can restore some volume loss too, and there's two really important ways to do that. One is a fat transfer. We take fat from your belly or thighs and we inject it into your face. And just like a filler, you get the volume benefit, but you also get the growth factors from that facelift or from the fat transfer. And those can actually make the skin quality look better and look a lot more softer. But the last thing that people don't realize is that facelifts actually restore volume too. When we're releasing the face in the mid part of the face and resuspending it up to the cheek, that volume that's here is now redistributed along areas where things look nicer, brighter, and more natural. And so when you pair that with a fat transfer, that is the absolute best result. Is everyone a candidate for a facelift? No. But I do think that is a great place to kind of start if you're like, I don't want to have filler, I don't want to have biostimulators, I just want to get things one and done, and I'm worried about contour in the lower face and neck. Both of those can look really nice. The other thing that has become sort of less popular, but a little more popular now because fillers are, again, not as big, are facial implants. So you can actually get facial implants in the cheek and under the eyes. These won't go away with time. They're sometimes made with silicone, or they're made with another material called MedPore. And these will restore volume to particular areas. They blend in around your tissues. The downside is they can be sometimes hard to place if not done by an expert, but these used to be a lot more popular prior to fillers because fillers are so easy to do theoretically. They fell out of favor, but they're starting to gain a little bit more traction, especially under the eyes where fillers aren't that common. So how do you know what option is right for you? It comes down to a few important things. What's your goal? Are you trying to restore volume where you've lost volume? You're trying to recontour your face where contour bugs you? Or are you just not sure where to start? Is this gonna fit in your lifestyle? Remember, biostimulators, even fillers, they require a significant amount of maintenance. And so if you're just not in a place in your life where you wanna go maintaining this or getting touch-ups or worrying about migration, I would skip that stuff. They are absolutely phenomenal and I do them every day in my office. It just depends on what your ultimate goal is. If you are bothered by laxity though, in addition to volume loss, these are for patients generally like 40s, 50s, and 60s, then I would just opt for the surgical correction, because at some point, if you're restoring volume up here, you're gonna also have accumulated volume down in the lower neck and things are just gonna look disproportionate. And as always, it requires a very thorough consultation from an expert to go through all your options and weigh the risks and benefits. In closing, there's really no one size fits all. If you're concerned about volume loss, remember it's a catch-all term to how volume changes throughout the face. Volume not only gets smaller, but it also moves throughout your face. So it goes from top to accumulating in the bottom, fat pads shrink up, and it's not like fat from up here goes down here, but it looks like that when you think about how the face and neck age throughout time. It can definitely be a genetic thing, but generally it's an age-related thing. Your treatment plan should be one discussed with you and your doctor about what your long-term goal is, what your long-term results are in terms of what you want, and if you want to do any maintenance for it. Remember that facelifts also restore volume when it's a deep plane facelift, and fat transfers can be done in the office, and really you don't have to do a ton of maintenance for it. If you like this type of content, don't forget to like, subscribe, and follow for more. I'll see you next time.